I am Manali Vyas, your host today for this webinar. This session will be for 45 minutes. This webinar is being conducted by Synergita. Synergita is a cloud-based performance management and analytics software which helps you focus on employee performance, employee engagement, and employee development. I would like to introduce you to the speaker for this session. The presenter for today's session is Mr. Jason Welsh. He is Human Resources Manager at Edwin Rehabilitation. Jason is a human resources professional with experience in recruiting, creation of retention programs, progressive discipline, conducting performance evaluations, administration of FMLA, ADA, and leave management, benefit administration, employee relations, conducting investigations, and collaboration with executives on policy creation and implementation. Before handing over the control to Jason, here are a few housekeeping instructions. All phones are set to mute. If you have any questions, please type them in the chat window located beside the presentation panel. We have received several questions from the registrants which will be answered by the speaker during Q&A session. We will continue to collect more questions during the session as we receive and will try to answer them during today's session. If we are not able to address your queries during the session, you will certainly receive answers via email shortly. Thank you for your participation and enjoy the session. Over to you, Jason.
All right, thank you very much, and hello, everyone. Again, my name is Jason Welsh. I'm the Human Resource Manager here at Edwin Rehab Hospital. I have been in human resources now 12 plus years, the last 5 being in executive director type roles in the healthcare industry. So I have a wealth of knowledge regarding different topics within the healthcare as well as the human resource functions in a healthcare industry. And I hope that you find this webinar presentation very helpful. So let's go ahead and get started here. So poll question number 1, does your company still do once in a year appraisals? So go ahead and take 30 seconds to answer that question for me. All right, so with the poll question, does your company still do once a year appraisals? It's either a yes or no question. In regards to that, the common theme is that performance appraisals or evaluations should be done at a minimum of once a year to best give the employees as well as the managers an idea of how the employee is doing, as well as constructive feedback on how to make any kind of improvements. All right, so some key points of what we'll look at today in performance management is what is performance management, job descriptions, staff evaluations, discipline or corrective action, employee engagement, or staff development and goal setting. So what is performance management? To put it simply, it is the process that ensures goals, activities, and expectations are being met by a workforce. Performance management can have many different components, some of which include evaluations, job descriptions, disciplinary action, employee engagement, and staff development and goals. The job description for an employee is the foundation that sets the initial expectation for each employee. There are many different ways to set up a job description, but there are some key elements that a job description must contain. First, it must have a basis on what task could or will be performed as part of the overall job function. Second, what the overall conditions of the job are. If the job is for a construction worker, then the overall conditions would be different than someone who is a secretary. And third, requirements of the job. If the job is for a physician or a doctor, then there would be a professional licensure requirement and education standards. The job description for an employee is, again, the foundation. Why are some of the values of the company important? Okay, they are the bedrock of what behaviors and standards are expected of all employees. They help the employee to know the ethical, moral standards that a company has for its employees. What's right, versus what's wrong. They are another area to help measure the overall success of the employee, and is the employee living up to the company's standards. The last thing you want is an employee that is not representing your company well. So below is a sample portion from a healthcare job description, and here's a couple points to note. One, the expectations are specific. Without a specific set of expectations, performance standards, or duties, the job description is open for too much interpretation, and thus inconsistencies can occur in the administration of the policies. If we're looking to have consistencies and be able to monitor those consistencies, then everything has to be uniform across the board. As you see in the below example, the expectation for the employee is specific. Okay? Provides the why to the task. Why is a nurse doing an assessment? Okay? It's specific. Performs a nursing assessment on all patients within 8 hours of admission. Specific. The data collected forms the basis for an individual's plan of care. Gives the why you're doing the task. Identifies teaching needs and goals related to the diagnosis of each patient from the nursing administration assessment, and by collaborating with patient, family, and the interdisciplinary team. Evaluations, the quintessential process for feedback and performance management. Companies generally have a process to evaluate their employees' performance. A formal evaluation process can take different shapes and sizes. No matter how an evaluation process is set up, the following questions need to be asked. What is the basis for an evaluation? Employee feedback, the evaluation of their performance, goal setting, and staff development. Those should be the 4 areas that you're definitely looking at. So let's take a look at each purpose. Okay, so we're going to evaluate their performance. The purpose of the performance of the evaluation is to provide the employee with constructive feedback on their performance. How are they doing? What are they doing well? What can they improve on? The evaluation needs to include the standards on how an employee's performance was measured, a comparison to the job description, for example. The evaluation rating needs to be a culmination of a period of time. What you want to avoid is just a recent history of an employee's performance. 12 months or 1 year is generally a good measuring point for an employee evaluation. Okay. Employee feedback. The evaluation process allows both the manager and the employee to engage in dialogue about the evaluation. Do they agree? Do they disagree? The conversation should both be meaningful and productive to provide insight on how the employee is doing and where there are opportunities. The process of completing an evaluation, providing feedback, and setting expectations should not be rushed. This process needs to be thoughtful, or the purpose of the evaluation will be diluted. Okay, so you don't want to use a cookie cutter or a standard template for your evaluations. You want to personalize it, provide specific examples. I've seen employees that have received very generic and basic employee evaluations, and generally they're not too happy, and generally they end up leaving the company because of it. Goal setting and staff development. Goal setting is an important aspect of the evaluation process and performance management. It is the basis for staff development. Okay. So the question is, why is goal setting and staff development important in performance management? For a number of reasons. First, it allows the manager to provide goals for an employee to work on and allows the employee to grow. Because you want to be taking your employees to the next step. You want to groom them, grow them. Maybe they're future leaders of the company. Second, it provides a basis for engagement. An employee who is engaged in his or her profession and facility will be more productive, thus providing better patient outcomes and satisfaction. Poll question number 2. Does your company set goals for employees at the beginning of every year? So go ahead and take a couple seconds to answer that question.
Hi everyone, this is Emmanuel here from Synergita. So we had a small technical issue here and Jason dropped off, and we'll wait for a couple of more seconds for him to join back. Hi Jason.
Hello.
Yeah, hi. Yeah.
Sorry about
You can
that. The
continue.
power went out here, so I'm trying to use my cell phone here. Can everyone still see the webinar?
Yes, Jason, you can actually continue.
Okay, super. Thank you. Right. So, again, does your company set goals for the employee at the beginning of every year? In reality, a company or a manager should set goals on a regular basis for their employees, whether it's once a year, every couple months, every 6 months. They should have a standard set for their goals for each employee. And then, of course, review those goals with each employee as they progress throughout that period of time. So goal setting and staff development. We use an acronym, SMART, and that stands for S, specific. The goal needs to be specific so that the employee knows what he or she needs to do in order to accomplish the goal. A goal that is not specific is difficult for a person to complete. Measurable, M. There needs to be a duration of time to complete the task. A, action. What is the employee needing to accomplish? R, realistic. The goal needs to be a realistic goal, one that can be accomplished in a time frame allotted and is not subjective. Some goals that I've seen are healthy weight goals to lose weight. That's not really a goal. It's great that someone wants you to be healthy, but it's not a goal for performance standards. T, time. There needs to be a deadline to complete the task. With a deadline, it becomes difficult to monitor and assess. So it could be short as a couple weeks, a couple months, or even up to 12 months for a year. But there has to be a deadline for assessment. All right, disciplinary action or counseling can be an effective tool to curtail an employee's behavior or habits. There are several items to remember when it comes to disciplinary action. First, consistency. As a manager, you must be consistent in your enforcement of the standards. The last thing you want and your organization wants is inconsistency, as this leads to other concerns with employment regulations. This is something I cannot stress enough. The biggest problem that managers run into is not being consistent in their enforcement of policies or finding ways to justify someone else's actions. For example, if the dress code requires a nurse to wear a solid color scrub and you allow another nurse to wear a printed scrub, then you've just created an issue. You've got a double standard here, and it now makes it difficult to enforce the policy equitably for everyone. Second, be specific and concise. Too often I see counselings that are very vague. As managers, you need to be specific in what is the cause of the disciplinary action, spell out the rule or policy they broke, and make reference to that policy. Remember to be concise in your writing of the counseling. You're not writing a novel here. You want to stick to the basics. What happened? Give a general overview, the rule that is referenced, that has been broken, and by this time you'll have conducted an investigation and have supporting documentation to support your decision to proceed with the counseling. Third, provide ways to improve. Have you ever had an employee wonder how they could improve or leave a meeting feel uncertain? Well, chances are maybe you have, but in this instance, it's due to the manager not providing ways that an employee can correct the behavior. The employee and the manager should be working together to correct this. It is one thing to bring a concern to a person's attention, but it is another to help them find ways to improve. Too often we're quick to criticize and forget to find opportunities for improvement. We need to spend time to develop the employee with the hope of making them a better employee for the long run. Poll question number 3. Does your company take employee engagement seriously as an initiative? So go ahead and take 30 seconds to answer the yes or no to that. All right, as far as employee engagement is concerned, employee engagement is a very integral part of performance management. It allows an employee to fit in with the company and the culture of that facility. So let's talk about employee engagement and start by defining it. Employee engagement is a relationship between an organization and its employees. An engaged employee is one that is enthusiastic about the organization and the role in the organization. An engaged employee is more likely to be a higher performer or producer in the organization as opposed to someone who is not. So there's several different ways employee engagement can impact performance. First of all, staff morale. As a human resource professional, the staff's morale is one of the most important keys to success in an organization. The morale of the staff can dictate the level of care provided to a patient. A person who is disengaged with the organization is more likely to do as little as possible, call off, and make mistakes, thus falling into performance management concerns. When the morale of the staff is high, there is less likelihood that there would be performance concerns. Second, teamwork. Teamwork, summed up, is a group of people working together for a common goal. In my time, I have noticed one constant in regards to teamwork, and that is that groups that work well together have a higher production, have a better role satisfaction, and have a better attitude. Teams that have great teamwork and chemistry tend to not want to disappoint their coworkers or let them down. They tend to go the extra mile for their coworkers. This type of attitude helps to alleviate a large amount of performance issues as each person does whatever it takes to help each other. One exercise that I like to do with our hospital leadership is an ABC exercise. So what I'll do is I'll sit down with each department leader and we'll go through their staff rosters and rate each employee an A, a B, or a C. A, staff rating as an A, are the highly engaged staff, the rock stars of the department. The staff that you just want to guide and mold for future positions as they have their own internal drive. These are the individuals that are most likely going to be the next leadership candidates. B, staff rating as a B, you're a steady employee. These employees come to work and do their job. They are not the best employees, but they can be molded and engaged. C, staff rating as a C are the least engaged employees or employees who are disengaged. These employees are the employees who tend to have performance concerns. These employees also tend to do the least amount of work. The key with the exercise is to strategize a way to move employees from a B and a C rating to an A. And also, how do we develop the staff who are in the A rating for larger roles, such as leadership? Staff development and succession planning. We briefly touched on staff development earlier in regards to goal setting within a performance evaluation. However, there are other tools that can be utilized in staff development. Part of staff development is succession planning. Succession planning is a systematic plan that provides guidance for an individual to move from one position to another of higher responsibility. Succession planning starts with goals, staff development, and a plan to get an employee from one position to the next. This process can be as short as 6 months or less, or can be a few years depending on the positions and the individual, but they all start with a foundation, and that foundation is goal setting. Through the evaluation process, the manager will look to ask questions on how they can help develop an individual or where does the individual see themselves. These questions are starting point for the staff development and succession plan phase of performance management. These questions are presented in a personal development plan or a PDP. The PDP allows the manager to gauge where an employee is and where do they want to go. From here, a manager and an employee can start to work together on creating and implementing a plan that achieves the goals of the individual as well as the organization. Here are some sample personal development questions to ask your staff. Each question in the plan should have a purpose, and that purpose is to provide the manager with insight and direction on where the employee wants to go in their career. Please share your progress made on these goals set during your last performance evaluation. Is there anything I can do to assist you? Have you or will you contribute to the company's key results for 2017? Are there areas I can assist you with learning and development? So ramifications of poor performance management programs. Poor performance management can lead to increased turnover, poor morale issues, and financial problems. According to some research, the average cost to replace an employee can be between $10,000 and $20,000, and sometimes higher depending on the position. Performance management is everyone's responsibility, not just the leadership of an organization. The frontline staff play a large role in employee engagement as their own personal development. So some best practices here. Performance feedback is done more than during an annual evaluation process. While an annual evaluations are a great time to provide feedback, an employee should know where they stand in regards to their performance. Prior to the evaluation, this starts with frequent feedback throughout the course of the year. Providing this feedback can come in a number of different forms, from casual conversation to a formalized conversation to a development plan. No matter how the information is presented, it is important that there are solutions to any concerns, as well as highlighting what the employee is doing well. Training provided to your managers on how to conduct an effective performance evaluation. It is one thing for a manager to complete an evaluation. It is another to make an evaluation meaningful to the employee. I cannot stress this enough. I train all of my leadership on how to do an effective performance evaluation, as not everyone has either done them or they've taken the time to seriously do them. This is why it is important to train your leadership on how to provide effective performance evaluations. Some items to include in training would be personalize the evaluation. Do not use a cookie cutter approach. Take the time to make the evaluation meaningful to the employee. This will show the employee that you care enough about them. Provide value-driven feedback. When providing feedback, always use specifics and make it a point to provide what the employee is doing well and if there are areas of opportunity, ways for the employee to improve. The same goes for goals. How can you take an average employee and challenge them enough to move them to an above-average employee?
Yeah, hi everyone. This is Emmanuel from Synergita. Thank you, Jason. It was a great presentation. So I will take a few minutes just to introduce Synergita to all of you. Synergita is an award-winning, continuous feedback-based employee performance and engagement solution. So the great thing about Synergita is that it's completely configurable, and all your existing processes and your workflows can be configured within Synergita. The configuration process itself is simple and easy to use. So you can start by just setting goals for your employees. You can select an employee from your team and start by setting a goal for him, and then you can keep tracking the progress that he makes towards achieving his goal. By doing regular check-ins. So once you do that, you can there's also another feature called continuous feedback feature, which helps you to interact with your employees on a regular basis. You can have day-to-day conversations with him, try and motivate him on things that he does on a day-to-day basis. Even if you think he's performing well, you can actually even give him a virtual award through this feature and motivate him. So there are other features within the software, like employee engagement survey, which helps you measure the employee engagement level, in your team and throughout the organization. So there is a feature called the 360-degree feedback feature, which helps you get feedback from, not only from your manager, but also from your peers and, people who are reporting to you, your customers, and all of that. So the Synergita software, comes along with more than 36, advanced analytics reports. All these reports are just available to you at a click of a button. So these are some of the best features of the software. If you want to know more about Synergita, you can probably visit our website. And what we'll do is we'll also send you a test drive link right after this webinar. And this test drive will be absolutely free for all the people who are attending this webinar. What you can do is you can log into this URL and do a test drive of the software and see it for yourself, how simple and easy to use Synergita is. Right. Thank you. And I think we can go on with a Q&A session now.
Thank you, Jason and Emmanuel, for sharing your experiences with us. Now we have received some questions and we will pose these questions to Jason. So first question is, which is the best performance management policy that other industries should learn from healthcare industry?
That's a good question. As far as policies would be concerned, I think it's really going to depend on what some of the concerns are with other industries and other facilities. Maybe one facility has problems with attendance, and that's where they're going to focus, a lot of their policies on. But what I would tell anyone is, make the policy specific. Have them specific to addressing specific concerns, as well as having them be consistently enforced. I think that's the key with any kind of policy, is the consistency in which they're implemented and enforced across the board. Because that's what's really going to make a policy, stand out and be effective in helping to drive the change that an organization is looking to make.
Thank you, Jason. Here is another question. What are some common employee engagement activities that you carry out in the hospital industry?
There's actually quite a few. They can be as basic as just making sure you're rounding and talking to your employees and building those relationships. I spend on an average day probably between 2 and 3 hours just rounding in my hospital, talking to the employees, getting to know them. And I think that lays the foundation. Some of the other things we do, we've developed an employee engagement committee. This committee is tasked with creating and developing some fun activities throughout the year for the employees to enjoy, like a summer picnic or holiday parties. Some other things that we do is we just have maybe a dress down day or a casual day. We may have a week where we just have small little activities that are just fun. For example, we just did one a couple weeks ago where one day, I think it was Tuesday, was National Mismatched Socks Day. So all my employees wore mismatched socks, and I took pictures and put them in newsletters and sent them out via email. So things like that to get the staff engaged. It doesn't have to cost money or a lot of money, just so they have fun and they feel like they're a part of things. Some other things you could do is recognition programs. I've got a recognition program right now that I've rolled out where, if they see an employee going above and beyond, they fill out a little nomination card, they tack it to a bulletin board, and then at the end of the week they get a certificate and they get recognized for doing that. So little things like that really make a big difference. And then, of course, you can go bigger, and maybe once a year you buy the entire staff gifts, things like that. So it doesn't have to cost a lot of money.
Thank you, Jason. Here's another question for you. How do you set goals for your employees in healthcare and hospital industries?
I think the goals, one, they have to start from the conversations that you've had with your employees. Whether they're basic conversations, where do you see yourself going in 5 years, for example, or have you thought about doing other things? And then you move them into, your personal development plans. How are they contributing to the company's goals? What can you do to better them? Or maybe, for example, you have an underachieving employee. Is there something that you can do as far as a goal to help them improve? For example, say their in attendance is a concern. How can we look to work with that employee on their attendance through the attendance policy, as well as helping them to improve that area? So you're going to look at different ways. Maybe some trainings involved. Maybe some coursework. Mentoring is another good one with other, model or high-performing employees. So you're going to look at every different aspect on how to set those goals. And then again, you're going to make them specific, and you're going to have them measurable over a time period, checking back in with that employee to give them feedback on how they're doing prior to the end of that cycle of time. So.
Okay, here's another question, Jason. How do you move an employee from C to A in ABC exercise? What things do you do?
Oh, that's a good question. I think the first thing you have to do when you're looking at the ABC exercise and you've identified someone that's disengaged is how do you re-engage them? What motivates them? For everyone, something has to motivate that employee, and everyone has different motivating factors. Money, family, schedule flexibility, for example, some other things. So you're going to want to find what's going to motivate that employee to, one, become re-engaged, and you're going to want to make sure you continue that motivation and grow that motivation. How are you going to foster them in growing, one, not only to be engaged, but to grow continually and perform better? So that's the first step. I think the second step is you're going to want to provide them with a mentor, one that can help them through maybe there's some aspects on part of their procedures or just their performance that are suffering. How can you help them to improve those? And this process is not going to be a quick process. It's going to take time. You're going to have to invest a lot of time and energy into this individual to move them to an A, but it can be done. And then, of course, recognizing them throughout this process. You started at a C, now you're a B. Make a big deal out of it, and make them feel, part of the team. Make them feel, appreciated and special. And those little things will help to go a long way in building that confidence and building that morale within that employee.
Okay, great, Jason. Another question here is, in the hospital industry, do you rely on any software for performance management?
I can't speak for all hospitals or healthcare. The ones that I've worked for, we have not utilized any kind of specific software for performance management. we'll use different programs and software to help us track where someone is currently, so we don't have to, remember that. But as far as specific software on, maybe drafting a coaching or a counseling, or other software may have different aspects to help in performance management, we don't. A lot of what I'm used to and that is out there is just reinforcing the policies, being consistent with those policies, and then having regular feedback and training sessions for all levels of the organization. And I think that usually does the trick in most instances.
Okay. Thank you, Jason. I guess we'll have to wind up a session for today. So thank you all for attending the session. Hope you all had a good and informative session. If you have any questions, please feel free to send the email at info@synergita.com. And also we will send the recorded version of this webinar to all the attendees. Once again, thank you, Jason. Thank you, Emmanuel. And goodbye.
Thank you very much.